Can't do that.
I think those are yours.
So when we talk about sleep, and I think it's so important to understand the sleep process and the sleep cycle and its impact on our lives, and really making sure that people are getting adequate sleep. It helps with their mental health, it helps with their physical health, their emotional well-being, and the whole 9 yards. So making sure that we're assessing that and we're finding out about it. Also finding out what people's habits are for when they're going to sleep, or what is your regimen, what's your bedtime routine, those kinds of things. Because having a routine for people who don't sleep well or who can't fall asleep, a routine can be very helpful for them. So making sure that you talk about that and you address it and how that process works for them. So sleep is the physiological process that alternates with periods of wakefulness. It provides healing and restoration, the circadian rhythm, and that's your habitual rhythm. So I don't know if you're like me, but 10 o'clock about every night, I'm ready to crawl in bed and start winding down, and that's just my habit. And then I'm up and going every morning, between 5:30 and 6 o'clock. That's my habit. So I don't necessarily need an alarm clock in the morning times. I set one just because I'm always afraid I'm going to oversleep. But typically my body wakes up between 5:30 and 6 o'clock. That's just my rhythm. That's the habit. That's my circadian rhythm that I have for myself. And everybody has their own. And that's okay. And then there's also the biological clock where some people are early birds and some people are late birds, and it just kind of some people like to work nights, and some people do better in the morning, some people do better in the afternoons. We all just kind of have our own thing, and that's just kind of our own biological clock. I always thought it would be interesting to do a study on people who were on their if they're an early bird or a late bird, to find out what time they were born, and does that have anything to do with it? If you were born late at night, are you a late owl? Versus if you were born in the mornings, are you an early bird? Does that have anything? I don't know. Probably not, but I just always thought that would be a cool little study to do, to kind of check that out, to see if there's any relevance between that or not. So sleep regulation really is done in the hypothalamus. So that's that little tiny gland in our brain, and it's really our sleep center. It controls when we get tired. It controls when we're awake, and it's an integrated process. So it deals with our central nervous system, our peripheral nervous system, our endocrine level, cardiovascular, muscular, and respiratory system. So there's a lot of systems involved when we talk about sleeping and making sure people are getting proper sleep and those kinds of things. So because of all the different systems that are integrated in the sleep process, it's very important that if people are not sleeping well, or if they're not getting adequate sleep, or they're not feeling rested in the morning, that we're talking about it and getting more details about it. And then we do some pretty significant studies, and those we call them polysomnograms. So you can do an EEG, and that's just measuring the cerebral cortex, the electrical activity of the cerebral cortex. An EMG measures the muscles, the twitching, those kinds of things, restless leg syndrome, all of that kind of stuff. And then an EOG, which measures eye movement. And eye movement is really important because that really tells you whether somebody is in rapid eye movement. So if they're going to start waking up, they start having that fluttering of their eyes, and when they're coming out of those deep sleeps, out of those sleep cycles. So we also want to measure their eye movements. So if you do a full sleep study on somebody where you're sending them to a sleep lab and they're hooking them up to all of these machines and monitoring this, this test costs about $7,500. So it's not something that you go into lightly. It's not something that you would recommend lightly, but it is very useful and very helpful, because if people aren't sleeping well, we need to find out why they're not sleeping, why they're not resting, because without inadequate rest, it doesn't allow the body to reset and regenerate and recoup for the next day. So very important that we do these sleep studies. We also do oxygen sleep studies, so if people, if you're afraid people aren't sleeping well at night or they're dropping their oxygen levels, then that's just that you put a little band on their finger and you're monitoring their oxygen saturation. That is not an in-depth sleep study. The polysomnogram is actually the sleep study that we want done because we want to look at muscle twitching and eye movement. And then we also measure the cerebral cortex and how busy that is while they're sleeping. So stages of sleep, the non-REM or you have non-REM, which has 4 stages, and then you have the REM. Dreams can occur in both of them. But most likely those vivid dreams happen in the non-REM cycles. So I put that sleep cycle on there. So your brain is active and you dream throughout your sleep. In stages 1 and 2, you first fall asleep, but you're not yet in a deep sleep. So I think about that, when you're starting to fall asleep and you hear a door close or you hear somebody walking, you can wake up to those kinds of things. That's stages 1 and 2, because you're not really in that deep sleep yet. Stages 3 and 4, this is when you're in that deep, restful sleep. So your breathing and your heart rate slow down and your body is still. So typically there is no body movements. There's not those twitching of the legs or the restless leg syndrome or anything like that during stages 3 and 4. This is your deep sleep. And then in stage 5, your eyes move underneath the eyelids, and this is what we call rapid eye movement. So from the reading, how often do you go through all of these cycles, all these stages? Do you guys remember?
What did you say?
How often do you go through them?
Every night, right? What do you mean?
Well, didn't it say in your books that about every 20 to 40 minutes we're cycling through the stages? Do you guys remember reading that?
I don't. Each cycle lasts approximately 90 to 100 minutes.
Okay. So yeah, so your stage 2 is about 10 to 20 minutes. Stage 3 is 15 to 30 minutes. And then stage 4 is 15 to 30 minutes. So about 90 to 120 minutes. You go back from, that's in your non-REM sleep. You'll go stage 1, 2, 3, and 4. 1, 2, 3, and 4. And you keep cycling through those stages every 90 to 100 minutes, okay? You don't have to know how long in each stage you go through, just that non-REM happens between 90 and 120 minutes, okay? But in your fundamentals book, the ATI book, it breaks down those sleep stages for you, okay? The average length of REM sleep is about 20 minutes. So when people hit REM, then they're starting to wake up, and that process lasts about 20 minutes to come out of the REM.
So you said you just cycle through, what did you say, 90 to 120?
For the stages, yep, for the non-REM. So recommended hours of sleep, neonates. So this is, remember, that's, day 0 to day 28. So they sleep about 16 hours. They sleep a lot, don't they? Infants, right. I wish I could sleep sometimes. I would just like 12 hours. If I could just be a preschooler, a 12-hour night would be great.
Right. I think my great.
We see that beginning to step down. So adolescents really need about 7 hours of sleep every night. And then young adults and middle adults, it's about 6 to 8. And older adults, I think it's 6 to 8 too. Older adults, I think to me that kind of caught me off, because usually older adults, I just seem to think that they don't sleep quite as much. because they're always up about 4 or 5 o'clock in the morning, some of them. And so it kind of caught me off guard. But I suppose they go to bed earlier, so they wake up earlier. So they're still getting the same hours of sleep. But so different sleep disorders that can happen. Hypersomnolence. This is people who have excessive sleepiness. So typically we think about hypersomnolence is about people who are sleeping 10 to 12 hours per day. Insomnia is difficulty falling asleep or frequent wakening at nights. Insomnia is very, very difficult. People really struggle with insomnia. So making sure that we're talking about it. And we're assessing it. One thing, there's lots of meds that are out there for insomnia we can use for that. I just, I think it's something that we have to be very cognitive when we're talking about sleeping meds, because sleeping meds require 6 to 8 hours of sleep every night. So if they're not getting 6 to 8 hours of sleep every night, the medication is going to have significant side effects for them. I always worry about the little old ladies that have to get up and go pee in the middle of the night. So if we give them a sleeping pill and they're waking up to go pee in the middle of the night, we're altering their balance, we're offering their mentation, all of those kinds of things. So I think it can be kind of scary. So it's very important, I think, in the nursing role that we're talking about this and we're finding out about it, because I don't think providers ask these questions enough. And so we really need to know about those little ladies who are getting up in the middle of the night, and putting them on Ambien probably isn't a good idea. Melatonin or something like that may be a little bit more beneficial for them. Sleep apnea. Sleep apnea occurs because of respiratory difficulties that impact people's ability to sleep. So if you think about, I always ask, do you snore at night? Does your partner ever talk to you about snoring at night, that you keep them awake? Do you ever have nighttime or morning headaches, or do you not feel rested when you wake up? Those are very important. We see morning headaches because they're not oxygenating their brain. If they have sleep apnea. So the brain isn't getting enough oxygenation, and so that's where the headaches occur. So just making sure that we're asking about those morning headaches. I even do a lot of this even for kids who have huge tonsils, and I'm really asking them, do you ever wake up with headaches in the morning? And does mom and dad ever talk to you about sleeping and those kinds of things? Because sometimes if those kids have those great big tonsils back there, we can only qualify them for tonsillectomies if they've had 5 positive streps in a year. So that's a lot. Whereas you can qualify somebody for a tonsillectomy if they are having sleep apnea, if they're snoring, if they're having morning headaches, and they're not feeling restful, you can qualify them for tonsillectomies by doing that kind of stuff. So making sure that you're assessing both of those things, I think, is very, very important. Narcolepsy is an overwhelming sleepiness and falls asleep. So narcolepsy is different. This is not somebody who just, I feel tired, I could take a nap in the afternoon. This is somebody who sits still for long. If they sit still long enough, their eyes go closed and they fall asleep. That's narcolepsy. There's a difference between sleepiness and narcolepsy. So making sure that we're identifying those kinds of things. Before you would ever diagnose with somebody with narcolepsy, you would, want to make sure their hemoglobin is normal. You want to make sure their thyroids are normal. Ruling out all of the other causes for sleepiness, and then they would need to go in and have that $7,500 sleep study before you put that diagnosis on it. Putting that diagnosis on somebody is a significant impact. They can't drive. Sometimes it takes them off of life insurance. So it's a big diagnosis. So you would never want to attach that diagnosis to somebody unless you've done all the studies. And I know that from personal experience, because my husband, a provider diagnosed him with narcolepsy, and he got kicked off of his life insurance. He's a pilot, so the Fed should have taken his license away from him. It was a big mess. We ended up having to pay for the $7,500 sleep study to be done to reverse that diagnosis. because it was put on and there wasn't an adequate workup. So it just making sure you be very careful about that because it's a big deal, very big deal. So sleep deprivation, and I think most of us walk around with sleep deprivation, and this is just dysomnia where people aren't sleeping enough or you don't get a good night's rest, those kinds of things. So I think probably 80% of us are walking around with some type of dysomnia, but it certainly isn't narcolepsy. In parasomnias, these are people who have respiratory and cardiac dysrhythmias that impact their health. And so there are people who have this. We do think that parasomnias, we think that this might have something to do with SIDS death. Those little ones who die in their sleep. We do think that maybe there's some parasomnia going on where there's a respiratory and an underlying cardiac and respiratory disorder, and that might have something or some correlation to do with the SIDS deaths and the rates that we have. We have not confirmed that. We do not know that, but it's just a thought process that's out there.
Wow.
So factors influencing sleep. If you go to your book, hi Joe, how are you? If you in your book on table 43, nope, that's okay. Table 43.4, it talks about all kinds of meds that can impact sleep and substances that can be out there. So make sure that you review that and you just know about those things. I think, chapter 43, table 4. So make sure that you take a peek at that. Those kind of questions, you'll see those a lot with in the pharmacology portion of your tests and those kinds of things. You'll see those questions sneak up. So I think just taking a peek at it and realizing how many meds there are, and these are everyday meds that can cause that. So lifestyles certainly can cause it. Doesn't help for you guys to know that the profession you're entering in is one of the biggest problems of sleep. Just because, we do 12-hour shifts and we bounce back and forth between nights and days and all of those kinds of things. So definitely that can disrupt our sleep cycles. So making sure that you know that because getting yourself on a schedule and figuring out how you bounce back and forth, because there can be significant health impacts because of those dysomnias that can happen. So just making sure that you're looking at that. Yep, Joe?
What are we using right now? What study guide are we using right now?
We're on page 998
of
the overview. The Harry Potter book.
Oh, okay. 994?
998.
998. Okay, thank you.
Yep.
Unusual sleep patterns. So you look at people who have restless leg syndrome, those kinds of things. People who have, big, thick necks, those kinds of things will all impact somebody's sleeping. Emotional states, people who are anxious and depressed really have a difficult time with sleeping. And so if somebody is talking about difficulty with sleeping, making sure that you're assessing for anxiety and depression because they can have both of them. I've seen people who have depression who sleep too much and don't sleep enough. I see people with anxiety who sleep too much and don't sleep enough. So making sure that you're assessing if somebody's talking to you about having poor sleep habits or not getting enough rest, that you're visiting with them about issues of depression and anxiety. Because if we treat the underlying cause, there's a good chance that we can fix the sleep problems that they're having. So making sure that we're dealing with those kinds of things. And then also the environment. And I think it's kind of funny. We all have our own little environment on how we like to sleep. I like to sleep with the TV on, and then when my husband comes to bed, he shuts it all off because he has to have pitch darkness. Some people have to have a fan on, and they need that sound of that fan to help them sleep. Some people sleep better when it's really toasty warm inside, and some people sleep better when it's nice and cold and they're wrapped up in their blankets. So everybody has their own environment that induces the best amount of sleep for them, and that's okay. But making sure that you're helping with people, and so you're talking to people about what your ritual is for bedtime. Do you have rituals? Do you have a process for going to sleep to winding down at night? And then talking about some of those kinds of things. Exercise and fatigue. Do you remember what you in the book? What did it say about exercise? When's the best time for sleep and exercise?
2 hours or more before
Exercise 2 hours before bedtime, I thought I read.
Yeah. Isn't that crazy? But it is.
Yeah, it is.
You would think that, you would think that if I'm exercising, I would be all wound up and I wouldn't want to go to sleep. But really, studies show that exercising 2 to 3 hours before bedtime helps with the best amount of sleep. So that means that you're in that non-REM sleep, that stages 3 and 4 for longer periods of time. You're hitting that 30 to 40 minutes, and so you're getting those nice deeper sleeps and resetting the body. So I just thought that was very interesting. I think that's very interesting because I think most people don't exercise at night because they're afraid that they won't be able to sleep at night.
Right.
And then excessive fatigue. Excessive fatigue has a huge part of, it starts that cycle, you're not sleeping and you're fatigued and you just can't get that sleep. You can't get caught up. So helping make sure that people do not get too fatigued and too tired. I think about these new moms that, you're tired and you're exhausted because you're up feeding all the time and very easy for these new moms to get themselves exhausted very, very quickly. And so, making sure that you're talking to them about that. And, is there somebody that can take care of the baby so you can take a nap during the day? Is there, what are your habits? What are your plans to making sure that you're still getting that 6 to 8 hours of sleep every day? That's so vitally important. So very important to talk about people who we know are in those situations that they're going to set themselves up for that fatigue, because it will set up a cycle of them not being able to sleep very well. And then food and caloric intake, and so important that we talk about that. Having those big carb meals right before bed isn't a good deal. It doesn't help with sleeping. It makes things worse for people. And so having those conversations with patients and talking about those kinds of things, not that they can't have a nighttime snack. We want all of our diabetics to have a nighttime snack, don't we? We want them to have a little bit of something at night. So crackers and a juice or, glass of milk or something like that. But we don't want them to have a big carbohydrate meal or a big meal. Like, I even think of like a big steak at night. Really, that's not a good idea because your body has to break that down while you're sleeping. So it's not able to go into that full rest mode, because your stomach has to digest that, and you're not getting into that big sleep. So important that we're talking about those mealtime things and how they do impact sleep. So just important to think about that as well. Different nursing diagnoses that go with sleep. You definitely know that anxiety, you can get too much or too little. Ineffective breathing pattern. And I think this is a big deal, and it's going to be a very big deal for us as nurses because we are in a generation of obesity. We're looking at over 60% of our population is obese. So with that obesity, it increases people's, having sleep apnea because, the thicker your neck is, all this flab when you're sleeping goes down and then cuts off that airway for people. So making sure that we're assessing those kinds of things and talking about that kind of stuff, because if they're waking up all the time because, there's a lack of oxygen and the body has to startle itself to be able to breathe again, they're not getting that stage 3 and stage 4 of the non-REM sleep cycle, which means they're not resetting their body. They're not giving the liver time to regenerate, not giving the kidneys time to regenerate. So big deals with that. It's that stage 3 and 4 that people's heart rate slows down, their breathing slows down, so the whole body gets to rest. all of the organs rest during stage 3 and 4. And if people aren't getting into that stage, it increases their chance of having a heart attack. It increases their chance of stroke. All of those cardiovascular things can happen because that heart does not get to rest at night. So just being mindful about those kinds of things. It can cause acute confusion when people aren't sleeping well at night. And so, we sleep, insomnia, those kinds of things can cause that acute confusion on people. The other thing with acute confusion during sleeping, and I think that's really addressing, seeing those older people who are on oxygen. So making sure that we're not putting that oxygen over 4 liters. If people have COPD and we're giving them high dose of oxygen, we actually make them hypoxic because,
right.
So just being very careful. I've had little old ladies that'll be like, well, I'm going to sleep. So they'll go and they'll just crank their oxygen up to 4 or 5 liters, per minute. And it shouldn't be there. So making sure we're cranking that back down on them, because it can cause acute confusion because they'll go into hypoxia because of too much oxygenation. So just being very careful about that. Insomnia, so people who can't sleep at night, who can't fall asleep. But when you're assessing insomnia, make sure that you're asking, do you have trouble falling asleep or do you have trouble staying asleep? Because those are 2 separate problems that we have to address. Typically if they can't fall asleep, then it's like, okay, we need to set up a ritual. We need to set up you need to have a pattern, what you're going to do. You need time to relax at night so that you can fall asleep, versus if there's if they're waking up during the sleeping time, that's a whole nother set of problems that we have to deal with. So making sure you're asking those questions. So fatigue, we definitely can get into that chronic fatigue if people aren't getting adequate sleep per night. Disturbed sleep pattern, where people are waking and more frequently than what they should. Oh, don't. That's rude. So they get that disturbed sleep patterns, and then readiness for enhanced sleep. So those are those people who fall asleep too early. So people who have narcolepsy and those kinds of things. So they have that readiness of enhanced sleep. So being very careful about those kinds of things. All right. So that's all I had for sleep. Let's go over those questions that I had and see where we're at, how we did with those. Does everybody have those out?
Yep.
Okay.
I don't have those out.
What?
But I remember.
Okay.
I don't have them out, but I remember.
Okay. So the
I don't
first
have a
question.
printer.
The first question is, a nurse is caring for a client whose partner passed away 4 months ago and has been recently diagnosed with diabetes. He is tearful and states, how could you possibly understand what I'm going through? So which of the following is an appropriate response by the nurse? A, it's time to get over the loss of your loved one. B, you are right. I cannot really understand. Perhaps you'd like to tell me more about what you're feeling. The third one, why don't you try something to take your mind off your troubles, like watching a funny movie? The fourth answer, I might not share your exact situation, but I do know that people go through when they deal with a loss. So which is the best response?
I would say
D.
B or D? So we know that A is not there because we're not going to tell people get over it, right? That's not appropriate. So we think possibly B. We know C is not right because you don't want to just avoid the situation and say, just forget about it, watch a funny movie. That's not appropriate. So B, we're contemplating between B and D, okay? So let's go back. B says,
So B is an open-ended question, correct?
B is an open-ended question.
So that would be probably most appropriate.
Absolutely most appropriate. Yep, it has to be that open-ended question. Now, D kind of sounds okay because it says, I might not share your exact situation, But I know how people feel when they deal with loss. And really, it's not a bad statement, but it's not the best statement. So just being very careful. Right. We're shutting them off. We're not giving them the chance to elaborate. So B would be the best option because it's the open-ended question available. Question 2. A nurse is caring for a client awaiting transport to the surgical suite for coronary bypass graft. Just as the transplant team arrives, or the transport team arrives, the nurse takes the client's vital signs and notes an elevation of blood pressure and of heart rate. The nurse should recognize this response as part of the general adaptation syndrome. And remember, we talked about that the other night. So is that the exhaustion stage, the resistance stage, the alarm stage, or the recovery reaction?
Alarm stage, isn't it?
Yep. Yep. So we know, because if we remember at the alarm stage, that's when the epinephrine or in the cortisone, all of those things are, they become elevated, which then elevates blood pressure and pulse rate. 3. A nurse is caring for a client who's been sitting in a chair for 3 hours. Which of the following problems is the client at risk for developing? Stasis of secretions, muscle atrophy, pressure ulcer, or fecal impaction?
Pressure ulcer?
Absolutely, pressure ulcer. A nurse is caring for a client who's on bed rest. Which of the following interventions should the nurse implement to maintain the patency of the client's airway? Okay, so the patient is on bed rest. That's important to know about in this question. And so which intervention is the best? Encourage isometric exercises. Is that going to help them with breathing?
No.
It'll help them with muscle atrophy, absolutely, but not with breathing, because this is a breathing question. Suction every 8 hours.
I say D as in dog.
D as in dog. Okay.
I say D too.
So B is not right because they're bed rest. They're not intubated. They're not, so we don't need to suction. And then give low dose heparin. That helps with blood clots, but not with breathing. So yes, incentive spirometry. And incentive spirometry, I know a lot of patients think this is so stupid. I don't want to do this, blah, blah, blah. I get it. But it really does work because it helps open up those lungs so that atelectasis can't happen where those alveoli are collapsing on one another. A nurse is caring for a client who is post-operative. Which of the following nursing interventions reduces the risk of thrombus development? Select all that apply. Instruct the client not to use the Valsalva maneuver. What is the Valsalva maneuver? Do you know what it is? Okay.
I looked it up, but I forgot.
What?
I looked it up, but I forgot.
Okay. So what we're doing is we're increasing intra-abdominal pressure. Okay. So what we're trying to do is get that pressure down into the aorta, because sometimes the abdominal aorta begins to collapse on itself. So we're opening up that pressure and moving that pressure down. So that will help with it. So the Valsalva maneuver is when people hold their breath and they increase that intra-abdominal pressure. Okay. So will that have anything to do with thrombus development? Blood clots?
Yeah.
No, it doesn't. Apply elastic stockings.
Yes.
Absolutely, that will. You bet it will, because it helps the circulation in the lower legs to prevent clotting or coagulation of those blood vessels. Review laboratory values for total protein levels. That's not gonna help you. It would help you for muscle atrophy if you were worried about somebody who had muscle wasting or those kinds of things. Looking at a protein level would be very beneficial for that, but not for thrombus development. Place pillows under the client's knees and lower extremities.
Yeah.
Yeah, because then you're elevating their circulation so that it's coming downhill. So yes, absolutely, that will help. and assist the client to change positions often.
Yes.
Yep, you bet it will. Perfect. A nurse in a provider's office is caring for a client who states that for the past week, she has felt tired during the day and cannot sleep at night. Which of the following questions should the nurse ask when collecting data about the patient's difficulty sleeping? Select all the questions that apply. Does your lack of sleep interfere with your ability to function during the day? Would that be important to ask?
Yeah.
You bet it would. Absolutely. Do you feel confused in the late afternoon?
Head fuzzy.
Read the whole answer, though. It says in the late afternoon. Would that have anything to do with sleep?
Yes.
No, if it would have to be if in the morning, if they had confusion in the morning when they woke up, then definitely that would be a concern. But late afternoon, there shouldn't be confusion from sleep. If they're having confusion in the late afternoon, it's more likely related to circulatory problems than it is to sleeping problems. Okay, does that make sense?
Yeah.
Okay. Do you drink coffee, tea, or other caffeinated drinks? If so, how many cups per day?
Yeah.
Absolutely, that's important to know. You bet. Has anyone ever told you that you seem to stop breathing for a few seconds when you're sleeping at night? You bet.
That would be important.
You're assessing for sleep apnea, aren't you? And tell me about any personal stresses that you're experiencing.
Yeah.
Absolutely. Yep. So A, C, D, and E are all right. Okay. A nurse is caring for an older adult client who's been following the facility's routine and bathing in the morning. However, at home, she always takes a warm bath just before bedtime. Now she's having difficulty sleeping at night. Which of the following actions should the nurse take first? Rub her back for 15 minutes before bedtime?
Yeah.
It would promote sleep, but it's not going to fix this problem, right?
Right.
I would love a 15-minute back rub, and we know that back rubs do promote sleep. We do know that. That's why as aides, remember, we always have to rub people's backs before, it used to be, anyway, when I was an aide, that was like a have to. Everybody got a back rub every night unless they refused. I mean, that's just how it was. I don't know if it still happens or not, but we do know it promotes sleep. But this lady, it may not be the answer in this case. Offer her warm milk and crackers at 2100. Is that going to help? Probably not.
No.
Allow her to take her bath in the evening.
Yeah.
Because that's her bedtime routine, right? And we've messed up her bedtime routine. So getting her back on her bedtime routine is probably going to fix the problem here. So offering that. And that's kind of a big deal, isn't it?
Right.
Have you ever been the nighttime aide?
Mm-hmm.
And then somebody's like, really? You want to put a bath in my shift? Because that's not what I typically, you know what I mean? So it does become a big deal. But it's how you fix the problem. And then ask the provider for sleeping medication. If you have to, you try everything else, that would be your least, that would be your last resort is turning to sleeping medication. But there's better answers here before doing that. So, but do you see how all of these answers, they're right, right? There's not one of them that doesn't promote sleep. A light snack before bedtime, back rub before bedtime, sleeping medication, they all promote sleep, right? But you have to pick the question that answers the question. And the question is about her taking her, her routine has been thrown off with not being able to take her warm bath at night, okay? So these are the questions that sometimes you get tricked up on, right? Because all of these answers are correct. You got to go back to the question, though, and dig out the information so that you're answering the question you've been asked, okay? And that's why I threw this one out there, because I think it's important that we practice these questions. A nurse is preparing a presentation at a local community center about sleep hygiene. When explaining rapid eye movement sleep, which of the following characteristics should the nurse include? Select all that apply. REM sleep provides cognitive restoration.
I didn't know how to answer these because I couldn't find. Anyway, I'm trying to look at the book and figure out which
All right.
answer.
How many people looked at the ATI book?
Didn't.
So open your ATI
I did, but I
book
don't
to
remember.
page 370.
$370?
Yes,
Talking
Emma.
about this.
The fundamentals. Yep, exactly that one.
370.
What version do you guys have?
Yeah, because mine only goes up to 355.
This is the one we have.
What edition is it?
9.0.
Oh, mine's 8.0. So go look in your syllabus, or look in the front. There should be a chapter on sleep.
Outside playing. I'm kidding.
What is
209.
Okay, go to page 209. Is there a table in there that talks about REM and non-REM sleep? Okay. So look at the REM and then let's answer this question. Does it provide cognitive restoration?
Yes.
Yes, it does. Does REM sleep last 90 minutes?
Yeah.
How long does it last?
20 to 60.
Okay. Is it difficult to awaken a person in REM sleep?
Yes.
Yes, it is. Sleepwalking occurs in REM sleep.
No.
Nope.
Nope. When does sleepwalking occur?
Is that NREM?
What?
NREM?
In non-REM. Stage 4. Stage 4 of
Right.
non-REM. Sleepwalking will occur. Vivid dreams are common during REM sleep.
Yes.
Okay?
Yeah.
So make sure that you're using this book too, okay? All right. Last question. A nurse is instructing a client who has a new diagnosis of narcolepsy about measures that might help with self-management. Which of the following client statements indicates understanding of the instruction? So this is somebody who's been diagnosed with narcolepsy. And we're trying to figure out which statement says that they understand. So we want the right answer here, okay? I'll add plenty of carbohydrates to my meals. Will that help
I
them?
don't know. Wow. No.
No, we want somebody with narcolepsy to not fall asleep, right?
Right. So breaking that down would be worse.
Yep. I'll take a short nap whenever I feel sleepy.
That sounds right.
That does sound right. The other answer is I'll make sure I stay warm when I'm at work at my desk.
That sounds like sleep.
We know that sets people up for sleep, doesn't it? And it's okay to drink as long as I limit it to 1 drink per day. Not somebody with narcolepsy. They shouldn't be drinking because it'll make them sleepy, okay? So what I wanted to point out with this question is that before we've asked questions like this and we've said which statement tells you that they don't understand the teaching. So then you have to pick the wrong answer, where this one says, which of the following client statements indicates understanding of the instructions? So you want to pick out the right answer, where sometimes you get these kinds of questions and it says that they don't understand. So then you have to pick out the wrong answer. Does that make sense?
Yes.
So I just want you guys to practice that, because you have to read the question at the very end. Do you want the statement that verifies understanding, or do you want the statement that verifies they don't understand? Okay, so making sure that you're reading those questions, because it can get very tricky sometimes, and we just need to practice walking through those. Okay? All right. So any questions on sleep?
No.
Any questions from the other night when we talked about activity and alarm and all of those? Arousal? No, none of the questions with that? Okay. All right. So that's
Joe,
all.
are you getting some weather?
Huh?
Are you getting some weather?
Yeah, really bad.
Yep.
Yeah.
I'm just wondering.
Melody, where are you located at?
I'm in Wagner.
Oh, it'll be coming your way in about an hour or two.
Wonderful.
Hopefully you're in the REM sleep.
I'm in the basement, so it won't bother me.
Put away all your lawn furniture.
One time I slept through a tornado. I was working nights, and so I always took a nap in the afternoon before I worked a night shift. And my husband calls me, and it was like 5 o'clock at night. He's like, "Are you okay?" And I'm like, "What are you talking about?" Because I was pretty pissed. It's like, he knows I sleep before I go work, and you woke me up. And he's like, "Well, there's a tornado." And he's like, "I just want to make sure you're okay." And I'm like, "Well, I'm not getting rained on, so I think I'm okay." He's like, "Don't be a smart." So I looked out the window and I'm like, "Oh, it doesn't look very nice out there." And there was a tornado.
Wow.
There was a tornado a half a mile north of my house. It took out a whole farmhouse. So I slept right through the tornado.
That's really close.
Literally, right?
I must have been in 3 or 4, right? I must have been in stage 3 or 4. So just make sure that look at the ATI book and read through that, okay? Because I think it's really kind of the nuts and bolts and kind of help with it. And like I said, I think the other thing is making sure you're using the ATI book, because over 70% of all the questions come from the ATI banks for all the testing, okay? Because it's an ATI-based test. So going back and making sure that you're going through those study guides or that book, I think is going to be very beneficial and very helpful for you. It'll be time well spent for you to use that, okay? All right? That way you don't feel like you're chasing your tail. It's all right there, okay? And so I apologize because I've been busy with funerals this week and stuff. So I will not send out the PowerPoint for next week until Saturday. I'll get it out Saturday morning to you. I'm not going to have time tonight, and then tomorrow night we have a dedication ceremony that we have to go to. So I'll get it out on Sunday morning to you. Okay. All right. Any questions that you guys have for me?
No.
Okay. All right. You guys have a great night, okay?
You too.
Night.
Stay safe.
Okay, good night.
You too.
Good night.
Sorry.
Bye.
He's cute. He's fun to look at. Good night.